You will realize that you voted to defund Planned Parenthood and to take away health care from 13.7 million Americans. And when this country wakes up in the morning, there will be consequences to pay for this.
Trump's big, beautiful bill, also known as H.R. 1, was passed by Congress in a session in the middle of the night. The current proposal would decrease women's medical autonomy by limiting access to reproductive health clinics, especially for women in lower socioeconomic situations. It would prohibit federal reimbursement to clinics that offer abortions, stopping federal funding for any of their services, including not just abortion care, but also STI testing or contraceptive education and access. That last part should feel like a major contradiction. If your goal is to reduce the need for abortions, you should increase access to contraception. Research consistently shows that increased access to contraception dramatically reduces unintended pregnancies and therefore abortions. For example, a study conducted by the Washington University School of Medicine found that providing free birth control led to a 62 to 78% reduction in unplanned pregnancies and therefore a 62 to 74% reduction in abortions. So what's going on here then? Either the big beautiful bill is dumb, even by today's standards, or the real motive has little to do with abortions directly. And this is where things get darker. The conservative policy blueprint called Project 2025 advocates for restoring the family as the center of American life, with an emphasis on traditional roles for men and for women. When asked before he was elected, Trump said he didn't know anything about Project 2025.
I have nothing to do with Project 2025. That's out there. I haven't read it. I don't want to read it purposely. I'm not going to read it.
Curiously, after his election, key leaders of Project 2025 have been appointed to influential positions within his administration. That includes the Director of the Office of Management and Budget, Vought, Senior Trade and Manufacturing Advisor Navarro, Attorney General Bondi, CIA Director Ratcliffe, Policy Chief of Staff Miller, Border Czar Homan, and many more. Importantly, Project 2025 calls for reducing access to abortions and to contraception, reducing coverage requirements on healthcare plans, including more exemptions for contraception for corporate offered plans. Putting this contradiction together, this starts to feel less specific to abortions and more about controlling the fabric of women's lives and their reproductive choices. Otherwise, they should be massively increasing contraceptive access. But to be really clear, even if the goal was narrowly focused on abortions, it would still be a bad idea to cut funding from abortion clinics. Cutting the clinics won't eliminate unplanned pregnancies, it's still going to happen. What it does mean, though, is that it will leave only one option for many people: unsafe, clandestine abortion options, which increases the associated health risks. There is still time for these proposed changes to be reversed, since the Senate is now considering the proposal. That means that now is the time to call your senators to demand that they oppose the House Budget Reconciliation Bill H.R. 1 and its provision to prohibit federal funding for healthcare clinics like Planned Parenthood.